Welcome back, everyone. We continue our special report this morning as we investigate Lincoln's overdose crisis. Here's a look at the latest numbers from LPD. 149 overall overdoses this year to date. That's 16 more than all of last year. Officials extremely wary of a specific combination of cocaine and fentanyl that's caused 30 overdoses in a 3-week period alone, 8 of which have resulted in death, 9 if you include an unborn child. And this morning, a local health expert weighing in. Dr. Phil Essay has been a staple in this community for 20 years. He says the trauma an overdose victim faces not only dramatically impacts the body, but the mind, which often leads to tragic results.
The signs are fairly consistent, and you can pretty much tell right away.
As a pain management specialist, Dr. Phil Essay has seen a number of overdose patients in his 2 decades practicing medicine in the Lincoln community, each case as sobering as the one before it.
It's a terrible struggle.
Sleepiness and confusion are just a couple of the symptoms he typically sees in overdoses, as opioids depress the central nervous system. However, that's not the scariest part.
Those who suffer from an overdose oftentimes don't recognize those symptoms in themselves.
Unfortunately, this isn't something new to him or the nation. More than 800,000 overdose deaths since 1999 across the country. Essay says, thankfully, the Lincoln community is taking action.
Some of the larger cities, but also some of the small communities scattered in rural areas have known that this is a problem for a very long time.
The hardest part for Essay, though, is watching the struggle an overdose victim has to overcome on several levels.
Patients have a physiologic or can have a physiologic dependence on these medicines, so when they deprive their body of those, they have extreme craving and they really feel quite terrible if they don't continue to provide their body with that. Then there are emotional and spiritual consequences that come from it too, and quite a lot of stigma and quite a lot of shame for these people.
Essay has had close friends watch loved ones struggle with opioid addiction. He says it can happen to any person of any age at any time.
70% of the people with an opioid use disorder are employed individuals. In other words, they work. School teachers and high school students and football players and construction workers and doctors and lawyers. And it often doesn't come just from recreational use of a medication. It comes from what was, at least originally, a legitimate prescription from a physician for some reason, motor vehicle accident or trauma of other sorts. An individual starts a medication and then they can't stop.
An Essay says he thinks twice, 3, even 4 times before prescribing any pain medication to patients, though he wants to reiterate the drugs themselves are not bad. It's how patients are educated on medicine before they take it. And for more on these stories and their special overdose series, just go to our website. We'll have all these stories and latest information posted there. Also, resources if you know someone impacted by addiction or overdose.